think the initial decisions which were going for shelter in place and lockdown were fully justified. You know, the estimates that we had at that time were based on very limited information. The best scientists in the world the best calculations possible. They're not to be blamed if they could not get it right, if they had data that were unreliable. So they were perfectly correct in going to make these decisions that were very aggressive. Right now, we have a more nuanced picture. We realize that we're dealing with a serious problem. We have a serious enemy. That virus can be lethal, but we know specifically how it can be lethal. We know that it can be lethal when it attacks elderly individuals, people with underlying diseases, people who are disadvantaged, populations who unfortunately we have neglected in this country and many other countries, poor people without health insurance, for example. They also attack hospitals that can get contaminated. Many of our hospitals are not prepared to deal with crisis, even in summertime. They can be war zones, and these hospitals were badly hit. I mean, several places in New York, for example. Doctors and nurses, they can get contaminated, and we need to try to avoid that because the infection usually has no symptoms, so it's very difficult to tell that someone is infected and avoid being exposed to that person. Mm-hmm. We need to focus our efforts on trying to really salvage hospitals that are under major threat, some other locations and settings like nursing homes, chronic care facilities. We need to protect vulnerable individuals, elderly, those who are sick, those who are in the hospital. You know, many people get infected in the hospital rather than the community. And at the same time, reassure the large majority of the population that their risk of dying or getting severe disease from COVID-19 is very low. It is not null. I don't want to say that there's no problem at all. But for the vast majority of the population, it is something that we should have less fear, and we should be open to deal with it and take steps towards reopening our society with science and with data and with careful steps.